Today we're going to talk to you about intervention techniques for a variety of motor speech disorders. The production of speech is a highly complex motor task that involves multiple systems such as respiration, phonation, resonance, prosody, and articulation. A lot of patients with dysarthria will require therapy to address these areas.
We will be discussing techniques specifically addressing the areas of respiration, phonation, and resonance. Respiration is crucial for speech sound production. Disruption to this system is common in motor speech disorders and can have a significant impact on efficiency of speech. Treating this system is often given priority since it is thought to improve other aspects of speech. One way to work on respiration is through diaphragmatic breathing. These exercises will help increase breath support to facilitate speech production.
It is easiest to begin this activity by having the patient lie on her back in supine position. Have the patient place one hand on her abdomen and one on her upper chest. Rest your hands on top of the patient's hands. Instruct the patient to inhale and make the hand on her abdomen come up. Explain that when the diaphragm descends, it pushes into the abdominal cavity and pushes the contents of the abdominal cavity out. This activity teaches the patient to use her diaphragm to pull more air into her lungs. Ask the patient to watch and feel for movement of the hand on her abdomen and to have no movement of the hand on her upper chest. Ask the patient to watch the hand on her abdomen descend slowly on exhalation. You can place a heavy book on the patient's abdomen to actually make this more of a strengthening exercise. That way the patient has to exert more pressure to lift the book. After the patient has mastered the appropriate breathing technique in supine, have the patient try the same technique standing or sitting as straight up as possible.
Phonation is the process by which the larynx produces sound. Disruption to this system is common in dysarthrias. This may result in either hypoadduction, which is characterized by a hoarse, breathy voice with reduced loudness, usually associated with flaccid dysarthria, or hyperadduction, which is characterized by a harsh or strained vocal quality and low pitch, usually associated with spastic dysarthria.
Have the patient hold on to your hand, a bed rail, the chair seat, or the arm of her wheelchair and pull up while saying ah.
Ah.
Have the patient produce the sound for longer periods of time. This technique can also be used as a compensatory strategy for short utterances. If the patient can stand, have her put her hands against the wall and attempt to push the wall away while saying ah. This technique can also be used as a compensatory strategy for short utterances. The yawn-sai exercise is designed to reduce tension in the vocal mechanism. Ask the patient to open her mouth very wide and try to yawn. The patient doesn't necessarily have to yawn, but she does have to approximate this very open mouth, open pharynx position. Have the patient produce a very quiet sigh when the yawn is ending and exhalation is beginning.
Easy onset refers to the contact of the vocal folds during the production of a word beginning with a vowel. The goal is to produce easy closure of the vocal folds into the airflow to produce the vowel sound versus a hard closure of the vocal folds and pushing a burst of air through. Using easy onset helps to ease tension of the vocal folds. Have the patient start her vocal folds vibrating easily. You may need to model the difference between easy onsets, hey, and hard glottal attack, a. Now you try saying the vowels with easy onset. Okay. Hey,
E, I, O, U.
Very nice. Now you can begin with vowel sounds and work up to trying vowel, consonant, vowel sequences, initial vowel phrases, and then eventually to conversation.
Hypernasality is caused by velopharyngeal insufficiency found in flaccid and spastic dysarthria. Reduce the perception of hypernasality by using exaggerated mouth openings and overarticulation. In addition, use increased loudness in order to help the listeners perceive what the patient said.
Hi, how are you?
I'm good. How are you?
I'm good.
Great.